Hello, I am Dr. John France of the Eastern Virginia Medical School, Department of Ophthalmology. Today we're shooting a video to cover the basic eye exam. The assumption will be that the history has been taken and that there are no portions indicating a specific eye problem. This exam is the type of exam which one would do as part of a normal physical examination to briefly rule out pathology in the eye. It should take about 2 minutes and uses equipment commonly found in the clinic. Luke will first wash his hands, which is basic to starting any physical exam as an infection control procedure. You'll also notice that he is bare below the elbows, another technique for reducing the risk of spreading infection from patient to medical staff. The first part of assessing the patient is measuring the visual acuity. We must have the patient occlude one eye, and this can be done either with the occluder or with the patient's hand. If the patient's hand is used, then they must use the palm of the hand and not the fingers.
The Rosenbaum Pocket Vision Screener is commonly available in most emergency rooms and clinics and has print of various size. On the right side of the card, the print size is identified by both Jaeger type and by Snellen equivalent, and those can be used to record the visual acuity on the patient's chart.
If a distance eye chart is available, this can be used to measure the acuity at distance. The patient should wear their best correction.
Can you read that for me?
I can. It's OFL.
Alternatively, if no eye chart or near card is available, one can have the patient look at magazine prints of various types and record the smallest seen. Confrontation visual field exam is the next portion of the exam. The patient removes their spectacles and occludes one eye. The examiner should have the patient look right at the center of their face and ask if any portions of the face are missing or blurred. Then, fingers can be presented in each of the 4 quadrants.
2, 1, 2, 1.
And it is good to simultaneously present targets to be sure that the patient has simultaneously presents.
2.
In the pupillary examination, light is brought up and the pupil reaction is observed. The shape and size of the pupil are noted, and if the pupils are equal, round, and reactive to light, it may be recorded as PERRL. A swinging light test can be used to determine whether one reaction is brisker or more complete than the other, and a difference between the two is indication of optic nerve disease. To check ocular alignment and motility, the examiner shines the light into the patient's eyes and asks her to directly fixate on the light. Then the light is moved into the 6 cardinal positions of gaze. Any lack of movement of one or both eyes is noted, as well as any abnormality in the way the eyes move, such as shaking, which indicates nystagmus. Okay. The next portion of the eye examination is the external examination of the eye. The examiner should note the position of the brows, the position of the lids, the shape of the orbits, and any apparent lesions of the eyelid or orbit, such as masses, tumors, proptosis, or drooping of the lid. Next, one looks at the ocular surface. To examine the ocular surface, a flashlight is used. Patient's lid is retracted while they look up. Look up, Jimmy. Or look down. The appearance of the surface of the cornea and any redness or discharge on the conjunctiva is noted. The ophthalmoscopic exam is then performed under a dim illumination. The examiner sets the dial to approximately 8 to 10 diopters, backs off about 8 inches away, and finds the red reflex. He then follows the red reflex into the pupil, simultaneously dialing down until the retina gets into focus. This helps to detect papilledema, cupping, macular degeneration, and retinopathies.
Let us now summarize the steps of the eye examination for the general physician. 1. Visual acuity is checked and recorded. 2. Visual fields are performed. 3. The ocular alignment and extraocular movements are examined. 4. The pupillary examination is conducted. 5. The external examination of the lids, lashes, and orbital region is performed. 6. The ocular surface, including the cornea, conjunctiva, and anterior chamber depth, are examined. And 7th, ophthalmoscopy is done to look at the retinal fundus. Intraocular pressure is not included as part of this examination. That is the end of our presentation on eye examination for the general physician. We hope that you have enjoyed it and will learn these examination procedures and apply them to your patients in the clinic.